Hi, and welcome to the Owatonna Today Show. I'm Shelley Whitehead. It's a joy to have you here, right where you can see us 6 days a week. It's fantastic, right on Charter Channel 8. You can find us. You can see us 7 days a week on YouTube, as well as thirdhandvideo.com. There's always great information we have for you right here on the Owatonna Today Show, because we want to make sure you get the information you need from your community. Like today's show, so excited. We're going to be speaking with Amy Swain in her hearing center and talking about some really important things that hearing loss is connected to. So you're going to want to listen to that. Also, Deb Gillard is here to talk to us about Clare Bridge and Brookdale Senior Living care community. We're going to talk a little bit about, I'm so excited about this conversation because a lot of us are going through having some situations of aging parents. And what can you do? How can you help them? You need to watch, so stick with us. But we want to let you know that we're also looking for great ideas, new topics to talk about. So if you have an idea you'd like to share with us, you can give us a call at 390-5751. That is Leanne's, our producer's phone number. Or you can give us an email, and that's at owatonatoday@charter.net. Let us know what's going on so we can get you on the air and have fun and talk about and give the information to the community. Great way to do it. So stick with us. We'll be right back after these messages.
I'm Dan Branstead of Carlson Branstead & Company, Certified Public Accountants. We support the Owatonna Today Show.
Owatonna Public Utilities, real people, real reliable, real progress. Making life a little easier day after day, taking pride in our community, listening to what you say, a voice you can talk to. We're growing with you. Owatonna Public Utilities.
Greetings, I'm Laura Ressler, Director of the Steele County Historical Society, and I welcome you to our History Center. We invite you to join in all our activities events where we honor the past and look towards the future.
And we're back with the Owatonna Today Show. We're here to talk with Amy Swain. Hi.
Hi, how are you?
I am so good. Glad. I'm good and glad. So I'm glud. I don't know, making up words here today. So tell us a little bit about yourself. Let's introduce yourselves to our audience.
I'm Dr. Amy Swain. I am an audiologist at my own practice in Owatonna, Austin, and Waseca. And I primarily help people hear better. Mm-hmm. I do hearing testing and help them with their hearing aids.
And this is, I just really do, every time you come in here, you must think I'm a fangirl of yours, because I really do appreciate what you do for people. You'd really change their life and make their life so much better. But today, we've talked a lot about different kinds of hearing aids, that kind of thing. But today we're talking about actually the physical and health benefits or detriments due to hearing loss. So tell me a little bit, where should we start with this conversation?
Well, what I'd like to do eventually is I've got these booklets where it's just little cheat sheets on different topics that are, where hearing loss is related to or correlates with certain types of diseases.
Okay.
Things like when someone has cancer and they're going in for cancer treatment, any of the types of treatments like radiation to the head and neck or any of the platinum type chemotherapies, they can damage the hearing. And so when someone's going through cancer treatment, a lot of times what's not looked at as closely as it should be is whether they're getting a hearing loss from the medications that they're taking to fight the cancer. A physician should recommend having that hearing tested every so often during the treatment to make sure that they're not doing too much damage to that area.
So because if they are doing damage, there's things they can do to adjust the treatment. Whereas if you wait till the end, it might be too late.
Well, quite possibly.
Okay.
I mean, I'm not going to say a doctor should adjust his course of treatment because of the hearing loss, but at least then know that you have the hearing loss and to treat it, because that can lead to all kinds of other things. One of the other things I wanted to touch on, as far as, and if anybody wants one of these packets, I've got a bunch of them down at my office, or if a physician wants to look at it, I have that there for them too. But not just cancer treatment, but also, having a cardiovascular disorder, high blood pressure, that type of thing. It leads to, less circulation and can damage some of the hearing that we have.
Well, just like your fingers. So when you have frostbite, there's no circulation there, and that's what causes them to be damaged.
Basically, yeah.
And so that's the same thing for your ears. Again, something I've not thought of before.
Yeah.
Yeah.
Well, and there's even a study here, and that's what it's in this pamphlet. The study actually talks about if you find a low-frequency hearing loss instead of a high-frequency hearing loss, there's a direct correlation to cardiovascular disease and a low-frequency hearing loss. And so some of those people, if they come in and they've got that low-frequency hearing loss, maybe they should be screened for a cardiovascular program as well.
So they may
Or
not
problem.
have even noticed known that they had a cardiovascular problem.
Exactly.
And it's a great way just to kind of, I'm having problems hearing, go get it checked. Wow, could have actually saved their life in a way.
It
Yeah.
could, absolutely. One of the other things, and one of the biggest issues that we can run into is with dementia. Now, it's really recommended that when you're going in for a test to find out whether you have dementia or not, it's really recommended you have your hearing tested first. If you're not hearing the directions appropriately, you could answer the wrong way and have a false test on saying that you have dementia. On the flip side of that, if you have a hearing loss, it just takes that much more effort to understand what people are talking about because you're not hearing it right. And that continued strain to your system can cause some cognitive issues.
Okay.
And so, basically there's a study that shows that if you have an untreated hearing loss, that it could lead to dementia because you're straining so hard and concentrating so hard to try to hear the message. But then that also, the hearing loss can lead to social isolation where, I don't want to go out to that party. I don't want to sit with these people. I can't hear what they're saying, so I'm just going to sit in a corner and do nothing.
Yeah.
That social interaction is very much needed to help keep dementia at bay.
Yeah.
And so those two are very strongly related. And it would be nice if physicians are counseling their patients. You've got a hearing loss. Well, let's get this checked out and work with it so that we don't have problems like this later on in the future.
Yeah. And there's there's even more. That's what's crazy about this is it's not just one or two things that hearing loss can impact or impacts hearing loss.
Yes. And type 2 diabetes. If you have type 2 diabetes, I would encourage you to have your hearing tested on a regular basis because, again, the circulation isn't there, as far as getting in by the inner ear. The blood isn't circulating well enough, and that can cause problems with your hearing. If you have type 2 diabetes, you're more than 2 times as likely to have a hearing loss. So, that's a significant amount of people,
It
and
is.
and diabetes, let's face it, it affects a lot of us.
It's on the rise too. Yeah. So it's definitely something that you want to come in. Again, these are things that maybe your physician isn't necessarily talking to you about because that's not their expertise.
Right.
And so by talking about it today, we're really encouraging people to get out there and do just a check. It's painless. It's just, and you know what you're doing, so it's quick.
I'd like to think I do.
Well, I don't know. I think we can kind of qualify. When you have 3 places, you should know it by now. So if not, otherwise you're in trouble. Well, and another, what I think is fascinating is that sometimes our doctors aren't telling us to do this, and sometimes we think, well, then maybe we don't have to if our doctor doesn't tell us. But again, it's not something that they're expertise in. It's not what they're working in.
Well, generally you're seeing your doctor because of the cancer, because of the diabetes. Another thing is the increased risk of falling. Maybe you went to the doctor because you've been falling a lot. Interestingly enough, if you've got a hearing loss, you're a little bit less aware of your surroundings, and that might cause you to trip and fall. The balance, there might be something with the ears there. Again, a hearing test can help us try to sort some of that out. But just having the hearing aids in, you're more aware of your surroundings. You hear if somebody tells you to look out so you don't trip on something. There's all kinds of factors involved in that increased risk of falling. So that is also related to an untreated hearing loss. And it's amazing to me how many things can be related to that. And a lot of people might think, the hearing loss is minor, but it's not if it's making other issues in your life worse.
Yeah, or a safety issue,
Right.
something that can really hurt you. So when people, when they decide that, okay, I might be having problems hearing, maybe, or I do have type 2 diabetes or these other things, what's the process for them when they come in? What's a hearing test like for you?
A hearing test is very simple. You come in, it takes about 15 minutes. just to find out, do you have a hearing loss? Is there something you should go to the doctor for? Maybe talking about some of these other issues. Do you have diabetes? Are you being treated for cancer? You know, those types of things. Or just talk to your regular doctor about it and say, you know, I'm just curious, I've been falling a lot. Maybe should I have my hearing tested?
Yeah.
And, you know, if you happen to be asked to go through the dementia testing or for Alzheimer's or anything like that, you know, maybe have the hearing tested first. You know, even just us being aware, the patient being aware. We can't always rely on the doctors to always go through all of that. We would like to, but you know, it's our bodies. We need to take some of that responsibility too,
Right.
and say, how about a hearing test? These other issues are what's going on. And so this booklet, it's just like, you know, the cliff notes of everything, like you know, hearing loss and falling and type 2 diabetes and how it relates to hearing loss, that type of thing. If there's a doctor out there that would like me to drop off these cliff notes for them, I'd be happy to do that.
Well, again, it should be a partnership, but this is about health issues, you know. And I know, like, I was talking to my mom, who has very obvious hearing issues, but she's like, oh, people just say this and people just say that, and I don't know. And part of this is kind of just understanding that you can't go by what the old wives are saying, those old wives' tales, you know. You have to be careful. You have to really kind of understand that technology has changed, things have changed, and the only way to know is to try it yourself. And she's really nice. Look at her. She's, she's adorable, actually. So, you know, there's not a threat there at all. And so I really do encourage people, because actually the hearing tests are free.
They're free at my office, yes.
Yeah. So just come on
call.
in, and there's no cost to that. Just come in and see, and the conversation is easy. And I think that they'll find that it kind of changes their life, wouldn't you say?
Absolutely.
Yeah.
Absolutely.
Good. Where are your offices located?
I have an office in Owatonna, Austin, and Waseca. The one in Owatonna is at 685 West Bridge Street. It's in the same shopping center as Torrey's.
Okay.
Most people know where Torrey's is, or behind the Taco Bell. I like the Taco Bell myself. And phone number is 507-451-3879 if you'd like to schedule an appointment.
Okay. Do you take walk-ins? If
I'll
there's
take
time?
walk-ins if I'm available, but I do have a tight schedule,
Yeah.
so
It'd be better to call and make an
ahead.
appointment. Okay, good.
Yeah.
All right, well, thanks for your time. This
bet.
is fascinating. I'm keeping this one. This one's mine.
you can have that.
All right. We'll be
Send it to my mom.
Yeah, I know. Dear Mom, do it. All right, we'll be right back. Please stay with us.
Recreational fires are allowed within the Owatonna city limits. They must be contained within a fire pit or a device designed for such use, and can be 3 feet in diameter and no more than 3 feet high. They must be 25 feet from a building or combustibles. Only untreated or unpainted woods must be used. Fires must be attended by a person at all times that are capable of extinguishing the fire. This has been a safety tip from the Owatonna Fire Department.
Have you talked to your teen lately about marijuana? Maybe you should. Regular marijuana use can sap a teen's motivation to learn. Users do not live up to their potential and drop out of positive activities. Marijuana affects memory and learning and stays in your system for weeks. Marijuana also affects judgment and perception. Reaction time while driving is reduced by 41% after smoking 1 joint and 63% after smoking 2, affecting the safety of your teen and others on the road. You need to talk to your teen about the effects of marijuana use. It's not just a harmless high. For more information, please contact the Safe and Drug-Free Coalition of Steele County.
Hi, I'm Glenn Mager.
And I'm Tim Thomas of the Brick Mager Funeral Home, and we're proud to serve the Medford and Owatonna areas with cremation and traditional funeral services.
And we're proud to be a part of the Owatonna Today Show.
Hi, this is Barry Gillespie, president of ERA Gillespie Real Estate, where our pledge is to save you money, save you time, and simplify your life. And we're proud supporters of the Owatonna Today Show.
Hello, I'm David Einhaus with the Owatonna Foundation. Thank you to all of our donors who have helped make Owatonna a better place to live. Will you join us today with a financial gift? Owatonna Foundation is a proud sponsor of the Owatonna Today Show.
And we're back with the Owatonna Today Show. Deb's totally sitting in the wrong seat.
What? Did I say what? What did we do during the break?
Do you feel weird over
Sometime
there?
host of the Owatonna Today Show.
Yes.
You know what? It does. After so long in that chair, and then even once in a while, of course, helping out as a host too. It just does feel kind of funny to be on the other side. But there's another part of my life.
It is, and I think that's why I'm excited to talk about this today.
Okay.
Because it's such an interesting thing. What you've done is you've taken on a career where you're helping people in a very, very fragile part of their life.
It is.
And so oftentimes it's also misunderstood, and there's just a lot of confusion that can go on that. So we're going to kind of clear up a little bit of that, as well as talk about some of the amazing things. So first of all, let's tell everybody your other job.
Okay, I work with Brookdale, which is a senior living company, and here in Owatonna, the company is very large. However, here in Owatonna, our care communities are very small. We are Sterling House Assisted Living with 19 apartments, one level. We are Clare Bridge Memory Care Community, and we have 26 residents there, 24 apartments. So they're unique to their own needs. They both fall under the category of assisted living, but the one community is assisted living with memory care, with a specific emphasis on memory care and all that entails. How to handle dementia at meal times, how to handle, how to work with our residents at bedtimes, what it means, expressions of behavior, and that's one thing that I'll just mention coming up in a teleconference that we have. But it's very gratifying. It really is, to help people find solutions for their loved ones, whoever they may be.
Well, and I love that you said it's a small community, and that's on purpose. You've created a smaller community to be able to...
It feels like a home. It feels like my home.
Yeah.
It feels like it's one level. The apartments a lot of times are very open.
Which is great for those who might have mobility issues.
Yep, we feel kind of like a big family. So I encourage anyone to come and visit. It's not a pressure situation. I'm not the kind of person that's going to follow you around afterwards. So
I don't know, Deb. You follow me around a lot, so
both people in
the
people in the care field and families, and I do encourage people to start looking and seeking information maybe before it's urgent or emergent.
Well, that's kind of hard though, because then you're kind of like admitting the inevitable. But what does that? What advantage does that give you when you kind of do it ahead of time?
It gives you information, it arms you with all sorts of information that you need when the time comes. So even if it's not right now, maybe there are other solutions that I can suggest. Maybe a care community is not warranted right now, but what can I suggest? And I work with a lot of our care partners here. Healthy Seniors, a great volunteer organization to help come in and keep people in their homes for longer. Home health care, avenues and assistance that we didn't have long ago in the past, we have now. And maybe eventually a care community like ours is something that people will have to consider, because either the house is not suited for it, someone can no longer go downstairs to a shower, don't have a walk-in, step-in tub, which would be a major expense in some cases. Those kinds of things. But we talk about that, and I don't try to make ourselves the solution, at that time, but for some people, of course, it is. And so just kind of finding out what's in front of you, what's available, what kind of support and information can you get, so that when and if there would be an emergent or an urgent situation, or things really start to spiral in a certain direction, you don't feel like you're trying to amass all this information, because it really is, it can be a lot of overload.
Well, no, I was going to ask about more like an emotional issue. Sometimes when you're in, because you're worried and there's expenses and all these problems coming down on you, you might not make the clearest, most level-headed decision unless you do that a little bit earlier.
Yep. So kind of to have a plan in place. Here's how we see things going, and we all know how plans are. They don't always follow our plan, but to have a plan in place of kind of how you see things going. And that speaks a little bit to a class that I will be holding. One of the things that I am very, very gratified to have, and I'll mention a couple of other things too before I mention that, is a lot of great corporate support. There are a lot of teaching tools that are available to me to help out families, to help out those in the community who help others, seniors.
And by corporate, you mean from
Brookdale.
Yes.
So if actually someone goes on our website, brookdale.com, there's all sorts of resources you can find there. I always drive people also to the Alzheimer's Association website, even if it's not dementia that we're talking about, but assisted living, there's great information on there. Questions to ask when you're looking for home health, questions to ask when you're looking at assisted living, all those kinds of things. So that's really important to me. We do we join a live teleconference every month on the third Tuesday. It's more for care professionals. In fact, they can actually earn a credit.
Which they have
of
to amass.
continuing
Yep.
ed. Yep, it's for nurses, social workers, case managers, and nursing home administrators. The one that's coming up is Tuesday, September 16th. I always have them at the Owatonna Public Library. I log right into the teleconference, and it's interactive at that time. It has to be held at that time, and because I'm there as a Brookdale representative and I feed everybody lunch, there's no cost. No cost for lunch, no cost to the class. It's really nice. Now, you don't have to be one of those individuals if a topic strikes you and you want to come, but obviously for those who are earning continuing education,
great.
I hand a certificate to them
Nice.
as they walk out the door. The next topic on September 16th actually does speak to dementia, and the topic is called When Words Alone Are Not Enough, Communicating Effectively Through the Stages of Dementia, and that would be solving behavioral expressions. So we do hear about that. So that is something coming up that I wanted to mention too. The third Tuesday of every month is also a memory care support group for me. And I just want to make sure that people know the group has been as few as one person with me, which is still a support group.
Oh, yeah.
And we've had as many as maybe 6 or 7. So it's a very non-invasive, non-threatening. Completely the conversation is driven by what my attendees want to talk about. We have previously been meeting at Clearbridge or Sterling House, but just because the group it sometimes grows to that 7 level, and we are small care communities, we're just now starting in September to move that off-site. So it's at 2:30 at the Owatonna Public Library. Again, I'm just going to stay there maybe for my teleconference. I'm not sure. Maybe take a little break, but that's where we'll be meeting in the upstairs Gainey room on the 3rd floor.
And this is a support group for people who care for those who might have.
Yes.
Okay.
And again, it does not have to be related to Clearbridge. We certainly do have those who have come and gone and continue with us in the support group that have had a loved one with us at Clearbridge. It could be someone, I'm thinking of attendee right now who, or in the past, who had someone at a care community, a loved one at a care community in the cities. But they live down here, and they're still struggling with some of the expressions of behavior and things that they're seeing the loved one go through.
And even, so I love that, because it's not necessarily a caregiver who's with them 24/7. Even if you have a family member or even a very dear friend who's going through this, and you don't know how to handle it, this is the place to go. Obviously.
We've had husbands, wives, daughters, sons, you name it. Any caregiver who is really handling dementia in all of its shapes and forms can really use some support.
Good.
So that's one thing too. Kind of speaking a little bit then to what you alluded to before, I will also be teaching a community ed class on October 23rd. I think the brochure comes out this week, as a matter of fact.
Oh, for community ed?
Yep, for community ed. And it's called Helping Aging Parents, When Is It Time to Intervene? Now, it sounds like kind of a lofty title, like we're going to make all these big decisions, but but that's not the way it's really structured. So it's really talking about you and I as adult children, or helping any loved one. Again, I've spoken with nieces, nephews, grandchildren, sisters, brothers. So we're not always talking about parents. So just keep that in mind. But what to be looking for? Very good information about what are we seeing, and I'll just use one example: car safety. Should someone be driving anymore? We may have to do a little detective work if we're not living with them. We need to really go out and take a look at their car. Are we seeing dents that we didn't see before? Take a ride with them. See how their reactions are. Yes, I mean, really kind of take pains to see, are they safe on the road? One of the most difficult things we deal with. But
and that's so interesting, because sometimes we're just like, oh well, but you have to start taking time and be really invested in these people who are aging, and you have to be just like a child. It's again that reverse thing. You need to kind of watch them and step back, and it's not gonna, I think that is for their safety too, not just for.
The interesting thing about this particular talk is that I know in the description of the class, finding care options and maybe finding a care community and some of those things that I talked about might actually be the easy part. It's actually how to take on that role as adult children. You don't want to be the boss of your parents. They are your parents, and they have earned and are due that respect, but you want to help them. So it's definitely a journey that you really want to join forces and be hand in hand and find out their wishes. We don't know unless we ask. We may assume all sorts of things about our parent or our loved one that we think, well, they'd be happy there, or they'd be happy with this, but when we do that, we run the risk of roughshod, kind of running roughshod over them and kind of making decisions without them. So this class is designed to take a look at kind of those things like the car, what to look for, then strategies to address those concerns, and then where to go for additional help. So it's,
People want
I'm
more
really excited
information,
about it.
Where can they get more information about the class
They
and
can
everything?
always call me, teleconference, support group. I see that my number's on the screen. The community ed class, I know will be signing up directly through community ed. And so just look for that information, or if they have questions about what it's about or whether it's appropriate for them. But again, it's free. I'm encouraging people to just come and find out some good information.
And you're also doing a walk to end Alzheimer's.
Yep, and I know we have to wrap up, but we are, our host family here is the Billy Springer family. Yeah, she was a force in this community. A lot of people will know Billy from all of her works, but her family is our host family. She has passed away, and they are definitely creating an honorable space for her being our host family. The walk is October 4th. We have a Clare Bridge and Sterling House team. If anyone is interested in joining us on our team or donating, or thank you to those who have participated in our fundraisers thus far, but if you want to donate and still do some things, definitely participate in the walk and do so with us if you'd like to.
Thanks, Deb.
Yeah, you're
Good to
welcome.
see
No
you.
problem filling 10 minutes,
we never
right?
see each other. This is weird. All right, we'll be right back. Please stay
Thanks,
with
Shelley.
us. Yeah, I know, both of us. It's crazy.
Hi, I'm Amy Martinez.
And I'm Adam Martinez, owners of Snap Fitness in Owatonna.
Snap Fitness is a fast, convenient, and affordable fitness center, and we're proud supporters of the Owatonna Today Show.
Everyone deserves opportunities to have a good life, a quality education that leads to a stable job, enough income to support a family through retirement, and good health. But the reality is, many children fall behind, many families are struggling, and many others are in poor health. United Way's goal is to find long-term solutions. Thanks to a grant from the Otto Bremer Foundation, we're hosting community conversations this year to address these issues. If you'd like to join us, please call our office.
Hello, I'm Shawn McNulty.
And I'm Deb Gillard with Brookdale Senior Living, Sterling House, and Clare Bridge of Owatonna.
And we are a proud sponsor of the Owatonna Today Show.
And it's time for a look at some of your community service announcements. Join Riverbend Nature Center staff for a class on the fundamentals of archery. To try the challenge of shooting a bow and arrow, staff will give instructions on shooting techniques and safety. This is August 27th from 5:30 to 6:30. It's at $10 for non-members, $5 for members, and that fee is required. The community is invited to a special Liz Oleg trunk show brought to you by Sonia Parr of local clothing company Imago Venia and Pink Pantry Coffee and Gift Shop. This is Friday, August 29th from 9 to 3 in the Pink Pantry Coffee and Gift Shop, where you will have the opportunity to purchase one-of-a-kind clothing. Liz Oleg clothing is fashionable yet ethical, on-trend, fashion-forward, and comfortable for all ages. Plus, Liz Oleg clothing is considered fair trade and is made in 10 countries around the world. Proceeds will benefit the Owatonna Hospital, unbudgeted items, and scholarships for students in nursing and health-related fields. Owatonna Foundation announced a grants deadlines. It's their September 1st. Owatonna-based nonprofit organizations that address one of the foundation's interest areas may apply. Application and guidelines can be found at the Owatonna Foundation website or by contacting the Owatonna Foundation at 507-455-2995. Thanks so much for joining us today. We'll see you on Friday when we talk to the Senior Citizens of the Year, as well as an update on the City of Owatonna. See you then.